Hey everybody. I wanted to do a few videos about how I treat patients and how I focus on performance with patients rather than just simply getting them out of the pain or the discomfort that they're in. And that there is a very big fundamental difference. If we wanted to just simply get someone out of pain, then we can deal with things that reduce their awareness of their pain. We can do things that try to reduce the pain at a local level. But if we're really going to resolve pain, we have to resolve the source of that pain. So to understand pain, we have to understand the way the joints are meant to work and why they're producing pain. And very often it's because they're not working well. If the joint isn't working well, it will tell you it's not working well by giving you the sensation of pain. So what does that mean? What does it mean to have a joint that's working well? It makes sense to make the joint work well rather than just focus on pain. It's kind of going a step deeper. But in order to make the joint work well, we really have to break down how that joint is controlled, how it's stabilized, and how the muscles can function to give us our strength and flexibility and endurance to be able to use that joint on a regular and repeated basis. And there's nowhere more apparent than these needs than in athletes. So performance is really a great way to focus our practices towards getting to the core of issues and actually helping the person to really develop the fullness of their capacities. So in this video and some following videos, I'm going to go into how I work towards a higher degree of performance with all of my patients. So it doesn't matter whether they're coming to me with pain in their hip or they come with a headache, whatever it is, or whether they're an athlete just trying to get a few more seconds on their run. Everyone needs more performance. Some of us don't realize it. They come with sort of simple requests, but in my practice, we're focused on performance. So in this video, I'm just going to start with the beginning of what is absolutely essential to having good performance, and that is having good functioning joints. And behind that is the ability to have a stable joint. So what that means is that there's lots of muscles around joints, and I'll go into it perhaps in more detail, but just at a basic level, what that means is that we have muscles of different layers around the joints that have different functions. The muscles that are very close to the joint, when they contract, they're not very good at moving the joint because they're so close to the axis of motion of the joint that when they contract, they really just kind of hold the joint together. And then some muscles can contract and relax, or some of these muscles can contract and relax to help guide the motion of the joint, but they're not really very big, strong movers of the joints. They're really just kind of holding the joints together. And those are what we call intrinsic muscles. So intrinsic muscles their main focus is to create stability of the joint. And that's really what I want to focus on today. If these muscles are working well, then the other muscles, which have the layers further out, when those extrinsic muscles contract, they can actually pull on the joint and move your joint in quite a big way, okay? And that allows us to move and do the functions and sports and things that we want to do. However, if that pulling of the joint is also coupled with a lack of function of these muscles that are stabilizing the joint, then what ends up happening is the joint will move more than it should and create an irritation or create a damage in the joint. So depending on if it's a very, very fast, short motion, or if it's a very fast motion that takes the joint to the end range and beyond the end range, we can actually sprain the joint. We can damage the ligaments that are supporting the joint. So those ligaments shouldn't ever really be stressed except at that end range. So as long as we're keeping the joint from getting to the end range in our activities, then we're probably not going to be damaging ligaments. However, if these stabilizing muscles, which are meant to kind of bring the joint back to its neutral position, but also slow down its motion away from neutral, or actually give a bit of a holding effect so the joint will move, but at the same time not move too far. There's a point when it gets to the end and it just stops the joint from moving, rather than the ligaments stopping it. So if those intrinsic muscles are doing a good job, they're going to take the potential of damage of the ligaments away, or at least dramatically reduce it. So again, if those intrinsic muscles that are stabilizing the joints are working well, we have a much lesser probability of damaging the joint in terms of spraining the joint. So this is a really, really key element. So if those muscles are not working well, then we can have a motion or even just a simple activity. When people are playing tennis or they're playing football, they might put their foot down a little bit funny and the foot starts to turn. If their body can't stabilize that ankle, then the ankle moves too far and they sprain their ankle. If they are reaching for the ball in tennis and they step on their foot, and their knee undergoes a certain stress, but their body can't stabilize the knee, then the joint's going to move more than it should, and you're going to stress a ligament. So that's something that's very, very common in tennis as well. So anyway, the point is that intrinsic muscles play a very, very vital role in stabilizing the joint. But one of the most tricky things about them is that they're very hard for us to consciously activate. In other words, there's even exercises it's hard, even with an exercise. I can't just say to someone, do this exercise and you'll turn on that intrinsic muscle. It's not that easy. So it really takes a certain level of understanding of how the system works to be able to firstly see where those imbalances of those stabilizing muscles are, and to know how to resolve those imbalances. So it turns into a bit of a wormhole as we go into the depths of it, and perhaps I'll do that more in another video. But there are ways that we can get those muscles to work more effectively. But at a very, very basic level, I'm going to start with one thing that we can do, which is to see where that muscle is weak, and we can do that. The chiropractors do that through palpation. There's other tests we can do. But if we see where the joint is moving too much, then that's probably an indication of a lack of stability from those intrinsic stabilizers. If at the same time we find a motion, again, where it's moving too much, but then where we feel resistance of the joint to come back to neutral, then we'll probably find as well that there's muscles that are tight, okay, that are keeping the joint from coming back to neutral. So when one muscle gets weak, it can't contract, and if it can't contract, it can't turn off its antagonist muscle from the other side, so that muscle will get tighter, and the joint just stays stuck like that. So that's why following the trauma, the joint kind of doesn't work so well anymore. It's because we would have done a stretch to these intrinsic muscles, which has made them less capable of reacting properly. They're less reactive and less able to contract. Thus, if they can't contract, they can't turn off the antagonist, so the antagonist gets tight and it basically just stays stuck there. So one of the things that we can do, and one of the things that I do, is to figure out where these muscle imbalances are. And there's lots of really cool clues to know where they are. But if we can find where those muscle imbalances are and to do something to release the tension of the muscles that are opposite to the traumatized muscle, then we get those muscles to relax. So we can do a very fast stretch on these muscles. That's what chiropractic does. It uses a very fast stretch to relax the muscles and change their reactivity. So the muscles that were too reactive and too tight, we can decrease the reactivity. And when they stop contracting, they also stop inhibiting the other side. Thus, the other side can start to contract, and we can regain some local level stability. So this is what we're doing with the technique that I created called adjusting to neutral, is we're actually just looking at where the joint is away from neutral and being able to test and appreciate that there's an instability there. And if we find the resistance of the joint to come back to neutral, that's where we drive the joint back towards neutral, and we very specifically stretch the muscles that are keeping the joint from getting to neutral and keeping the joint from getting back to its stable position. So at a very local level, that's what we're doing with adjusting to neutral. Now there's many, many more layers to it, and there's many more layers to understanding the performance of a joint. That's just kind of lesson one of multiple layers of lessons on stability. But I just want to leave you with one more thing, is that, again, these stabilizing muscles have a very vital role in controlling the biomechanics of the joint. So if these muscles are out of balance, the ones that are stabilizing are out of balance, and again, these aren't under our conscious control. We can't consciously turn these muscles on. They're all reflexively controlled through our brain, and a lot of the joints are controlled at the same time. So if they get out of calibration, it really throws off the ability of them to function properly. So when we adjust it back to neutral, we're really recalibrating that joint and making its function much more fluid in concert with the joints above and below. The other aspect is biomechanics. So if we try to move a joint, if we move a joint in one direction, our body knows how the joint is wanting to rotate. So what it will do is it'll contract muscles on one side and relax muscles on the other side of these intrinsic muscles to allow the joint to move in a very specific way. So it's actually controlling that rotation. We don't have like a little pin that it just sort of naturally spins around. We actually have muscles that are controlling that motion. So they're contracting and relaxing very precisely to be able to make that motion happen exactly as it should. So if we have an imbalance of these intrinsic muscles, what happens is when one muscle is trying to contract to rotate the joint, but the other muscle can't relax, then what happens is the joint just simply can't rotate in one direction. So, and then if we try to rotate it in the other direction, where we would ask this muscle to contract and this muscle to relax, this one's already very contracted, this one's already very relaxed, so the joint will actually move too far in the other direction. But as well, it's actually changing the axis of rotation as well. So if the axis is sort of in between my two hands, it should be moving like this, okay? Then what ends up happening is if one side is tight, the axis of rotation will shift towards the tension, and the joint will move more in one direction like this, but then you try to move it in the other direction, and it just can't do it. So, and then everything in between gets messed up as well. So these imbalances of the intrinsic muscles play a very vital role, not only in stability of the joint, but very, very much so in the biomechanical function of the joint as well. So when we improve the balance of these intrinsic muscles, not only are we improving stability, but we see that the biomechanical compromises that were previously there are gone. So we now restore biomechanics and stability in one in one treatment, in one maneuver. So it is entirely possible to do that, and it's absolutely essential, because if the joint isn't stable and it isn't moving properly, then what's going to happen is it's much more susceptible to further trauma, and it's much more susceptible to undue stresses, because your body will compromise. If it feels instability, it's going to start contracting other muscles to keep you from moving that joint, and the extra muscles from other places is just going to load the joint, put more pressure on the joint, and create an excessive wear in the joint. So when we see osteoarthritis and accelerated breakdown of the joints, that really tells us that that person has had some sort of a compromise to the stability of the joint and the biomechanical function of the joint. So it's absolutely essential that the first step is always about stabilizing the joint, being able to assess and stabilize all of these joints, and particularly spinal joints, and then also to instill at the same time proper biomechanics. So once we do that, then we can start building strength, then we can start building flexibility, then we can start building performance and endurance. But that whole process of moving towards higher and higher levels of performance is completely hindered if we do not have stability of a joint. So if someone has unstable joints, and I can promise that pretty much everyone does, if you have an unstable joint and you try to train on top of that instability, you're going to end up with problems. So this is step number one with my patients, and particularly with athletes and performance patients, is we absolutely must resolve stability issues first. So anyway, I hope you find that interesting. There's much, much more to say about this. This is just a little bit of a start. If you like this, go ahead and like the video. If you have any comments, please drop them below, and I'll try to include answers or replies in future videos. Thanks for watching.